Hello, friends. Dr. Kelly Tanner here. I am the hostess of the Dental Handoff, and I have with me one of my favorite hygienist, Ryan Rutar. Ryan, welcome to the show.
Thank you for inviting me.
Yeah, you got to show everybody your coffee cup.
Oh, so I'm what they call a brony. So this is my little Rainbow Dash coffee cup.
I love Rainbow Dash so much.
Yes, she's like the energetic one, but I do it because I love her hair. I think it's pretty.
Yes. I love her hair. As soon as you pulled that up, it just brought back so much nostalgia for my daughter's childhood.
And I grew up during the first generation of My Little Ponies, so I was a brony even then.
Oh, yes. Well, it delighted me to see someone embracing My Little Pony again. So anyway, I just had to tell everybody that because I was just like, I love this so much. Ryan, we always ask, why dental hygiene? Like, why did you choose it?
It chose me. No, I'm kidding. Actually, a lot of searching kind of went into it because I was pre-dentistry. So I had finished my biology degree and I was a little burnt out. And so I kind of was like, what do I want to do next? Because I did like dentistry, but I don't like the restorative aspect. And basically that is mostly dentistry.
Yeah.
And so I'm like, okay, I've already done 4 years of something that I was like, I'm just doing it to get to the next step. And I was like, I can't do another 4 years of something that I'm not that passionate about. And I'm like, but I still want to work with teeth. And I'm like, there's got to be something out there that fits this mold. And then that's when I found out that dental hygiene was more what it was that I wanted. I wanted the relationship with the patients. I wanted the, getting them out of trouble or, stopping them from getting decay and stuff like that. And so I didn't realize, even though I had seen a hygienist since I was little, I didn't realize that that's who that was. I just thought it was, the dentist and their people, type thing.
Yes, the elves.
Right. And so then that's when I discovered dental hygiene, and I don't have to do 2 more years and I could get another bachelor's. Technically, it should have been a master's. We should talk about that at some point, but whatever. Because
salty topic.
No, I was taking classes with some of the dentists, but yet they didn't want to acknowledge it as a master's class, even though technically it should be, because if they were working on their doctorate and then you already had someone who had their bachelor's, but now I'm getting another bachelor's, I mean, technically it should have been. So ADHA, if you're listening, that's
there you go. Well, I mean, dental hygiene programs do that with the accelerated programs where the baccalaureate and the master's program students are together. They just have different together like this. Yeah. They pay more tuition, like one more credit hour or something, and they have extra work in the course.
Yeah, but they don't offer, I guess, someone who already has a degree, and then you could get your dental hygiene master's. Like, why couldn't you do that?
Right.
If you already have a degree, then technically, wouldn't it be, then you could have a master's in dental hygiene?
Yes.
So anyway, back to the original question. That's why I decided to go into dental hygiene, because it fit more my personality and the care of the patient. So
did you go right out into clinical practice? What did you do after you graduated?
Yeah, I did actually. I was actually one of the last people hired in my class, because, and this was only 2010, which, I mean, for some people nowadays, they'll be like, oh my God, that was so long ago. But for me, I thought like, oh, we're new age. This should be normal. But Nebraska, which is currently where I'm at, was not very comfortable having a guy hygienist. Because I even had in my interview, the people that hired me, they even discussed when I wasn't there, how comfortable are our patients going to feel having a guy work on them. And one of the receptionists said, she's like, well, you're a dentist and you work on them, so I don't understand why this would be any different. And so then he decided to give it a try. And, we've been together for 14 years, but it was just one of those weird things that you don't realize. Yeah. And again, I think men aren't necessarily encouraged to be dental hygienists, even though they should be, because to me, it's something that's very professional, very uplifting, and I think has a strong purpose. So I don't know why we don't encourage more men to go into this profession. But
For sure. It's equivalent to the male nurses,
oh yeah, definitely.
right? I
And
mean, I remember when that was a thing where people were like, a guy as a nurse, can that be a thing?
I know. And then you're
Yes.
like, is there really a uh, sexism thing with a career path? I'm like, I just find that weird, I guess, because to me, it's like careers don't have a gender. So
Yeah.
why are we assigning them one?
It's just what we're used to seeing culturally. It's just what we always have experienced. But I love that the front office personnel made the statement of the dentist is a male. There's nothing wrong with that. Why would there apply it differently? And how is it different?
Yeah, why does it make a difference? And I'm like, it's a good point. Like, if a
So,
dentist can sit there and work on you, then I'm pretty sure.
well, I love that person in the office had that voice and had that courage to be able to say that to challenge the thinking and the practice.
Yeah, she was a very intelligent person. She was a dental assistant first, and she had been there long enough, but it was kind of like the office manager gal. And she was just like, I don't really see how that's an issue. And my dentist is pretty liberal for the most part. But again, he was coming at it from a business standpoint that he's like, well, will I lose patients if they don't have that female representation in, the hygiene department? And it's like, I kind of get it because you kind of view females as being more nurturing. And so it's like, well, maybe people kind of want that nurturing individual in there. And then the dentist comes in, so then there's that nice balance.
Right.
But, being the LGBT individual that I am, maybe I fit both.
There you go. You fill both buckets. This is great.
Right. Well, because the indigenous population, they call the queer community two spirits. And so they're actually revered in some Indian cultures because of the fact that they view them as having male and female intuition. And so then therefore they kind of revere them and ask them for advice and stuff like that because of the fact that they feel that they may possess both qualities rather than just one or the other.
Wow. That's insightful. I did not know that. But it makes sense.
Yeah. I thought it was kind of cool.
Yeah. So you got this peek into this firsthand experience about how what the perception could be, right? And then you've been there for 14 years.
Currently, yes.
Yeah. And do you feel like that's changed at all?
I'm starting to see a little bit of it. Especially I feel like the East Coast, or maybe just the coasts in general, are getting more males. But I still feel like there's a huge lack in the Midwest range, because even with the classes after me, there's maybe one male or there's no males. And there's never like, oh, there's 3 or 4. Like, I've never seen that still.
We just graduated from Virginia Peninsula. We just graduated 2 males.
I know. Seeing how happy you are about being like, ooh, we got 2.
I know. And then they're just like, they were so funny. They're like, we don't want to be like the girls, but they kind of became like the girls, They're like, we're not the girls. We're interested. It was such an interesting dynamic. I'm like, get it together. Drop down and give me 10. I'm kidding. But no, it was awesome to understand their perspective too in the class and to hear their vantage point on different cases and scenarios. So I was just curious if you'd seen some change, because that's good.
Well, and also diversity always makes every institution better because of the fact that if you get a institution or a profession that starts to reflect what the average community starts to look like, then you have better access to care and representation, if you're starting to see those individuals within your own profession. So we're starting to work on that, but we need a little more effort in those places. And I'm happy to note that I'm working on that diversity piece with ADHA and the Delta Dental. They're trying to do a chairside recruitment piece where they're working to figure out how do we create ambassadors and then educate either hygienists or maybe even public health or school systems in order to get dental hygiene out there as a career path for people that may not necessarily see themselves, and try to get that more to those individuals that maybe need to see.
That's interesting.
Yeah.
That's that they could identify themselves in that role, in that career.
Mm-hmm.
Interesting.
Yeah, so that's something that I've been working on just recently, but they're going to start pushing some stuff out next year. And I think they're calling it the HI, which is as in the Hygiene Initiative, in order to be like, come ask me. And then they'll develop ambassadors, and then ambassadors will start to teach people, and then we'll do like chairside recruitment. Because a lot of people in like diversity wise, as far as like males and those that are of different ethnic backgrounds besides white, usually are recruited chairside.
Really?
By another hygienist.
I'm just like, tell me more, Ryan. They're usually recruited chairside. Okay. I mean, if you think about so many females, I would have to say, when you ask why hygiene, they're like, well, my hygienist was always this. That's my story. Uh-huh. I guess that counts as I was recruited chairside when I was 17. I don't know. Does that count?
About possibly? Yeah, no, absolutely. And that's what it is. And so we're trying to create hygienists thinking about looking at then other people and say, you know what, you would be a great hygienist. Here are some things to look for in individuals that you think would make them great hygienists, type thing. Because a lot of the times we'll usually reflect on people that kind of look like us or are like us, and then be like, oh my gosh, you would be great in this. And so that's why it's like, okay, well, now we need to go past, what's like us to then maybe, someone who may be a little different, but still would be good for the position. And
I feel like too, that's great to create value of what we do as well. Not that may not be the primary goal, but you're able to talk to people about what a hygienist does and what their responsibilities are.
Well, and I've done a lot of chairside recruitment, not realizing that I was doing it, but I would do that with male kids, because a lot of the time they're like, oh, you should go on to dentistry. And then I'd be like, or dental hygiene. And that's the thing, like, they never bother to offer dental hygiene as an option when it's male for some reason. I've seen that happen a lot. And so I'd always be like, or dental hygiene, like, let's not just stop at dentistry, but with females, I'd be like, oh, you should go into dentistry or dental hygiene. Like, it just flows. But it's like a male, it's like, you should go on to dentistry. I'm like, or hygiene.
That's awesome. Well, thank you for your work with that, with ADHA. ADHA is doing a lot. They always do so many great things behind the scene that they come out with, and that will be impactful.
Yes, and Delta Dental too for investing in it and then making it go somewhere, which is kind of cool.
Yeah, they saw the need. So, all right. So you went from clinical to discovering this. What are you doing now? Like.
So
I speak.
I do speak. So I still work clinical, but I also created a position for myself as the hygiene manager. So a lot of our offices are developed with an office manager, and then you have your dental assistants, front desk, the dentist, and then the hygienist, which I'm explaining something that's just obvious. However, and this is no offense to any office managers, but I don't think office managers should be running hygiene. I think hygienists should be running hygiene. And so I created the hygiene manager to equal the office manager. So office manager runs the front and the finances and all that jazz. Hygiene manager runs the hygiene department, the preventative instruments, the what is it that we need to order, and then the assistant and the dentist and work the restorative side. So then that way it's like each individual is kind of in charge and kind of creates a, sense of pride within themselves that they get to change within their own departments. Far too often it's, oh, well, I need to go ask the office manager if I can do this. And I was like, we need to get away from that. And
we don't understand each other's role. So just like we don't know what exactly they do or everything that a dentist does or everything that an assistant does.
Absolutely.
It's a whole different schedule with hygiene, and to have the confidence that it's being cared for and nurtured by another hygienist gives you that confidence in that.
Yeah. So the reason why I brought that up is because then that's what created pearly white prevention. Pearly white as in your teeth, and then prevention as we're prevention specialists. So basically, I consult in dental offices to try to create a form of pay, whether it's like production pay or bonus pay, but then also encourage a hygienist to step up and take the hygiene manager position, because that allows the dentist to be a little alleviated on not having to pay attention too much as what hygiene's doing if a hygienist steps up. And then they're in charge of watching for codes, and we kind of go over how to, make the hygiene department a little more efficient, what things to look for in different codes that you can use, just kind of give them the confidence that they may not have had. And so I kind of step in and kind of give them that role. So in that way, when I walk away, then I know that there's someone that's still going to continue technically doing the pearly white prevention part of that practice to make it successful. So that's that aspect. And then I also do speaking, and luckily that's been going well because now I can call myself an international speaker.
Sure.
So bougie. And that's mostly been focusing on mental health because I had high dental anxiety as a kid. So I really liked lecturing on dental anxiety and how to manage that within ourselves and our patients. And then I also speak on cultural sensitivity for the LGBTQ plus community.
So I'm going to back up just a little bit because I have questions. Okay.
That's what you're here for.
I know. I have questions. With the prevention specialist that you are training, you're leaving behind that model in the practice. Does that hygienist still continue to see patients?
Yes.
Okay. So they're that and a hygienist. I mean, a clinical hygienist as well.
Yeah. So, it's kind of like when you have a patient that cancels, then that would be your time to then be hygiene manager. So gotcha. It kind of gives you that opportunity to be like, okay, so now I need to look through, what is it that we still need to order? Let's look at our reports and see how we're functioning as hygienists. Is there one hygienist maybe shorter than the other as far as like, maybe they're not offering fluoride. And so then you would obviously have a conversation with that hygienist to be like, so is there a reason, what is it that's blocking you from having that conversation? And so it's those little types of pieces where a dentist may want to have those conversations, but now he can leave it to the hygiene manager to do that and make sure that hygiene's ran efficiently.
Gotcha. Got it. And that makes perfect sense. Yeah. So then second question, follow-up question. I have a hygiene group. It's called Next Level Dental Hygiene Career Professional Growth. Okay. One of the things that we talk about, or one of the things that's brought up and in other Facebook groups are there's no growth in hygiene. What do you think about that?
I feel then you're not putting your toe in the water or you're just tipping your toe in the water and you're not diving in, because I decided to get my master's in management. And basically what I was thinking originally was if anything ever happens to my hands, I need to have a backup plan for work. Well, then it turned into, well, how do we develop hygiene to make it more efficient? And then it turned into speaking, but it wouldn't have happened if I didn't go to conferences and try to educate myself with some of these other movers and shakers and stuff like that, and seeing what they were doing. And, or you could maybe get all of this experience and go, I know it's like FUPA, but go corporate in the extent like maybe educating in a company that you really like or something like that. I mean, there's so much out there, but you have to take the initiative to investigate and try to maybe do something more.
Yeah, it's in those rooms and in those conversations, I can sense that people are very myopic. They're thinking of their job only in one way or two ways, right? And if they apply what they know, and let's just say if they were to ask themselves a question, how could my skill set improve things in this office, things that I know could use improvement, to go to doctor with that and to give them those ideas, the doctor seeing the leadership in you. And then that leads to something else. And then that leads to something else. And then that leads to something else, because every something else gets you to where you are and where you want to be. But it takes you asking a different question of yourself.
Well, and a lot of hygienists have asked me, well, how do I even get started? And
Yeah.
usually I tell them, find one thing that you want to improve in your office, then be the only hygienist that does it, document and record it, then present it to the dentist and say, hey, this is how this has worked. This is how much better it's working because I'm doing it. Now, can we get the other hygienists on board? So then that way we can prove it. And yes, I would like to be paid for doing this.
Yes.
And that's how you start
Do
it.
it.
Basically,
Yep.
do it yourself and then record it or document it. And then you have proof behind what it is that you're doing to improve something. And it's something little that you can do. You're not trying to change everybody else. You're doing it for you first, and then you can work to elevate others if you so feel the desire
You're
to.
doing your own research pilot project.
Basically, yeah. And I do it all
Yeah.
the time.
And I was like, I'm going to see if I can do this and that, right? Like if a person has this, I'm going to see if I can do both of these procedures because I know what's best for the patient. And I'm going to see what the patient's reaction is. I'm going to see if there is more scheduled treatment. I'm going to see what that chain reaction of events are when I'm taking this one action or these two actions.
Right. And then it's like, oh, look at a codology book and then kind of thumb through and be like, huh, now that's something we could do that we haven't been doing. Or, oh, that's something we could start billing out and haven't billed out. And it's like, yes, a lot of people are like, well, it's not covered by insurance. And it's like, when does insurance start dictating how you treat a patient?
Mhm.
It's like, okay, well, then have a conversation with the patient and let them decide, not their insurance, what it is that they maybe want for each other. Because the thing is that I have noticed within our population, they're definitely becoming more preventative rather than reactive.
Yes, they are.
And you
And
have to,
we all want autonomy,
right,
right? To know what it is. We don't want for someone to make decisions for us to say, I don't think they can afford that or that they're not interested
right.
in that.
Yeah, you have to take the control away from yourself and give it to them.
Yes.
Because we're just like, oh, well, I'm in charge of their care and I'm in charge of their health. And it's like, okay, but they still have to brush their teeth. They still have to pay the bill at the end of the day. So it's like, it's not your money, but yet you're forcing your thoughts of their money control on them. And it's like, you need
Preach.
to let that go because that's not on you to hold. You need to let the patient decide that.
Correct. And when that changes, it's like everything changes. I
Oh,
feel like once you let go of that, it's like a chain reaction of other things that we don't even realize that we're even doing it during the day.
correct. You don't actually. And that's the other funny thing is that if you talk to a patient and be like, I'm going to give you these options, not because I'm selling to you, but I want you to choose what's best for you. And because a lot of times people will be like, oh, well, I'll just do this because I know you won't want the other because that insurance won't pay for it. And it's like already you're telling yourself no in your head without even giving the patient the option. Don't be afraid
Yeah.
of no. I think there's a book out
Yeah, and I find too that in our profession, we are generally speaking, I'm making a broad stroke statement, and I recognize that we're uncomfortable with making people uncomfortable.
there. Oh, absolutely.
Yeah, and it's not even conflict, right? You can't even call it conflict. It's just telling them something you don't think that they want to hear. It's like you have a crack in your tooth. What are they going to do?
Right. Well, and how I do get around that too, and I think this is part of the reason why I didn't want to be the dentist, is because, oh, you have a crack in your tooth. This could mean that you need a crown, but we're going to have the dentist come in and he'll let you know. So I'm like, no, I'm just presenting it to you, but you can blame him because that's not my job.
And scene. Where
That's
did Ryan go?
And they're like,
No,
where's
but
Ryan? He's so sweet. And I'm like, yeah.
why would Ryan ever try to sell me anything? No, but I mean, they patients rely on us to connect the dots for them and tell them what we're seeing. Period.
Yeah, it's true story. And
Yes.
it's like you have to be open to allowing the patient to say no. And a lot of times we don't even like to hear that or know that. And so we just avoid it altogether, which is another motivator, which is why I come up with like goals and productions and schedule or whatever. Because yes, granted, cash flow is an exterior motivator, not an internal motivator. but it still can help motivate you to have those difficult conversations if you know technically you're getting something out of it.
Yeah, but people are motivated by so many different things. It's like with the team, if they're doing a challenge of some type or training, oh, we can give you a Starbucks gift card. Or people are like, I want cold hard cash, or I just want a half a day off, or, it's different for everyone and what internally motivates them.
Oh, absolutely. But that's what I'm saying. Like, if a dentist wants to see change within their hygienist, it's like, okay, but you need to have then also the conversation of, well, they're just not going to do that. It's like, again, you're already taking your thought process into them. And it's like, you can have a conversation with what would help motivate you to have these conversations. What is it that you would like? And if they're like, well, if I could have, another 2 days of vacation, and it'll be like, okay, well, if you reach a goal, then we'll start adding, time to your vacation. Or some might be like, well, I just want the cash. And it's like, okay,
now we're talking.
Yeah, if you reach a goal, then it's like you can have a percentage of what it is that you produced, stuff like that. So there's lots of different avenues to help hygienists feel valued, basically.
Yeah. Ryan, do you have any words of advice or one or two things that you would say to hygienists right now with where we are in the climate of our profession of encouragement for them?
I guess don't be afraid of change, because there's only two ways that change is going to happen. One, it'll happen and it forces you to change. So it's like a snap of a rubber band. So something traumatic has to happen, and that's when you finally change. Or two, you can learn to accept it, learn with it, and then it doesn't rebrand or reverberate, snap at you quite as bad when you learn to accept change. So yes, we're going to have change in our profession. I know they talk about scaling of assistants. And then my thought process is, okay, so if they do have that, then why not have it to where then hygienists manage the assistants that are scaling, or oversee the assistants that are scaling. Yeah. It's like there's different avenues that we can take that is not necessarily having to push another profession down in order for us to elevate.
Strong words right there. I love that so much. And I think too, the number 3 with the changes, be the change, right? Come up with the ideas.
Right.
And be like, hey, I'm seeing a solution here. Could we, instead of being reactive to it or just having to be open to it. Well, it.
Yeah. And one thing that I do tell my hygienists that I manage is that it's like, okay, if you see a problem, instead of coming to me and complaining about it, you have to come to me with a solution, and then you can complain about it.
Yes.
Because it's like, I don't want to just hear like, oh, well, I hate doing this and I don't want to do this anymore. It's like, okay, well, what have you thought about then to help change that? Because that's the problem, is that we like to complain about it, but then we don't want to look within ourselves to figure out how is it that we want to change that.
Yeah.
Even though we have the power to make that change.
Yeah. Because then that doesn't lead to anything except for doing the exact same thing over and over.
Yeah.
And being dissatisfied, right? And affecting everybody else too in the process.
So, and like the other thing is that even if it's not a good solution, at least it's an effort to reflect and try to create change, and we can work together then to help get you to where you need to be. But it's like, if you're just coming to complain to me, it's like, okay, and what is it then that we want to do with that? Because you're responsible with creating some of those solutions.
Yeah. You are responsible for you.
That's right.
Right?
Yes.
Do that. Be responsible for you. Those are encouraging words. I love that you brought that up in terms of change, because even as the time that we record this and the time that it airs, we don't know some of the things that are going to change and what it's going to be like when this, even in 6 months, right? We don't really know. So I think remaining open to that and having a learning growth mindset is a big deal. And all of that, because it's our profession, what we do, who we are, our identity, our culture is in the middle of a lot of change right now. And
right.
I think it's an exciting time for us.
Oh, absolutely. And a lot of things, when you think about change too, is you have to focus on what it is that you can change within yourself, not necessarily how to change technically other people. because you yourself can change that. But if something else is going outside of you, sometimes you can't change that. And so sometimes you have to be the person that is the change you want to see.
Yeah. Be the change. I think that's the theme. Yes.
Hold us.
Well, Ryan, it has been such a delight having you. Our time always goes so fast. If you guys want more of Ryan, because who doesn't? He's on the circuit. Ryan, do you have like a place that people can go to see where you're presenting?
Yes. So I am on www.pearlywhiteprevention.com. And then you just click on the speaking tab and it shows you what I currently speak on and then maybe where I might be speaking. It's not as nice as Amanda Hill's. I'll work on it. But and then if you want to email me, I'm Ryan@pearlywhiteprevention.com. So that's pretty easy too.
Cool. Thank you so much for sharing your perspective and your story. And maybe we'll have you back and talk about some of the cultural diversity topics that you love to talk about and help people with. So Thank you.
And I'll see you again then at the
Rocky Mountain. Yeah.
Denver conference. That's right.
Yeah. Ryan will be at Rocky Mountain. We'll be speaking together. We'll have to get some Ussies.
Yes, we will.
Yeah.
Great.
All right, folks. Well, thank you for listening. And again, today, if you don't mind, I always ask the favor to go on to Apple Podcast and give us a 5-star rating because we know that Apple is the one that matters. And then go on over to YouTube, subscribe, press the subscribe button right now if you're listening. So the algorithm recommends our show to other people who will love us. Thank you for all that you do. We will see you next time, my friends.